Hi, I'm James Libecco, board-certified dermatologist based out of Cleveland, Ohio, with over 20 years of clinical medical experience. So a lot of patients end up on chronic antihistamine therapy when they really may benefit from more advanced therapeutic choices like RHAPSIDO for a variety of reasons. It may be that they don't know that there are more options available to them, or they haven't made it out of the cycle of emergency room and urgent cares that they've been going to, and making it to a provider like an allergist or a dermatologist who's comfortable with managing CSU in the long term. I saw a 40-year-old woman who presented with 6 months or so of active CSU. She had persistent hives and itching throughout the day and night, despite up doses of antihistamines that she had received. She had been through multiple rounds of steroids and still wasn't maintaining any degree of regular control over symptoms. At that point, we knew it was time to move on to another therapeutic option. When you sit down and talk with a patient who's been suffering with CSU, really get to understand how it's impacted their life, the degree of itch, the visibility of the lesions that often appear at inopportune times in their lives. It really speaks to my heart to be able to reach out to them and provide not just physical comfort, but also that emotional comfort. In my practice, I see an oral option like RHAPSIDO to be a good addition to my treatment options. When patients present to me, they've already been on oral antihistamines, and having an oral therapeutic option for them is often a comfortable discussion for that patient to move into. Ideally, my patient should be on an antihistamine for CSU probably not longer than 4 to 6 weeks before they're increased in options to more advanced therapies. So in my experience, patients are often on antihistamines for longer than I would desire when they make their way to see me. Having an oral option like RHAPSIDO in the treatment armamentarium has really been a benefit in getting patients started on therapy and comfortable with an administration route that they've already been doing with their antihistamines. After initiating therapy with RHAPSIDO for my CSU patients, in follow-up, they're telling me about the reduction in itch and active urticaria that they have on their skin. And this is consistent with the clinical trials for RHAPSIDO through 12 weeks, and some of those patients showing reductions in symptoms as early as 2 weeks.
Indication: RHAPSIDO, remibrutinib, is indicated for the treatment of chronic spontaneous urticaria, CSU, in adult patients who remain symptomatic despite H1 antihistamine treatment. Limitations of use: RHAPSIDO is not indicated for other forms of urticaria. Important safety information: warnings and precautions. Risk of bleeding: mucocutaneous-related bleeding occurred in 9% of patients who received RHAPSIDO. Interrupt treatment with RHAPSIDO if bleeding is observed, and resume if the benefit is expected to outweigh the risk. Interrupt treatment with RHAPSIDO for 3 to 7 days pre- and post-surgery or invasive procedures. Use of antithrombotic agents concomitantly with RHAPSIDO may further increase the risk of bleeding. Consider the benefits and risks of antithrombotic agents when used with RHAPSIDO. Monitor for signs and symptoms of bleeding. The use of live and live-attenuated vaccines should be avoided in patients receiving RHAPSIDO. Adverse reactions. The most common adverse reactions, incidence greater than or equal to 3%, were nasopharyngitis, bleeding, headache, nausea, and abdominal pain. Drug interactions. Remibrutinib is a CYP3A4 substrate and a P-glycoprotein (PGP) inhibitor. Avoid use of RHAPSIDO with strong or moderate CYP3A4 inhibitors. Concomitant use with a strong or moderate CYP3A4 inhibitor increases remibrutinib exposure, which may increase the risk of RHAPSIDO adverse reactions. Avoid use of RHAPSIDO with strong or moderate CYP3A4 inducers. Concomitant use with a strong or moderate CYP3A4 inducer decreases remibrutinib exposure, which may decrease the efficacy of RHAPSIDO. Monitor more frequently for adverse reactions when using RHAPSIDO with PGP substrates where minimal concentration changes may lead to serious adverse reactions, for example, digoxin. Remibrutinib increases exposure of PGP substrates, which may increase the risk of adverse reactions related to PGP substrates. No data are available on concomitant use of RHAPSIDO with anticoagulants. The concomitant use of RHAPSIDO and anticoagulants was not allowed in clinical studies. Use of the antiplatelet agents acetylsalicylic acid at doses up to 100 mg daily or clopidogrel up to 75 mg daily was allowed in the RHAPSIDO clinical studies. Use in specific populations. There is a pregnancy exposure registry that monitors pregnancy outcomes in women exposed to RHAPSIDO during pregnancy. Avoid use of RHAPSIDO in patients with mild, moderate, or severe hepatic impairment, Child-Pugh class A, B, and C. RHAPSIDO exposure is increased in these patients relative to patients with normal hepatic function.